This is part B of the lecture on Introduction to Anatomy and Physiology. In part B, we will continue to explore organization of the human body. Additionally, we will learn some anatomical terms. The body can be divided into an axial portion, which includes head, neck, chest, abdomen, and pelvis, and an appendicular portion, which includes upper and lower limbs. The axial portion contains several cavities that house body organs. These cavities include thoracic cavity, abdominopelvic cavity, cranial cavity, and vertebral canal. Thoracic cavity is located in the chest. In the chest, we have lungs, which fills up the pleural cavity on each side. The space between the two lungs is called mediastinum. In the mediastinum, we have pericardial cavity, which contains the heart. Thoracic cavity is separated from the abdominopelvic cavity by a muscular sheet called diaphragm. Abdominopelvic cavity has two parts, abdominal cavity and pelvic cavity. But these two cavities are continuous with each other. Some organs found in these cavities are liver, stomach, spleen, gallbladder, large intestine, small intestine, urinary bladder, and some other organs. Finally, we have cranial cavity, which houses brain, and spinal column, which contains spinal cord. In the abdominal region, we are actually going to contain a lot of different organs, mostly associated with the digestive system and some organs of the urinary system. To identify specific location of organs in the abdominal cavity, we can split the abdominal cavity into 4 distinct quadrants. The quadrants are established by drawing 2 imaginary perpendicular lines at the center of the umbilicus. Starting from the left side at the top, we have got the left upper quadrant, or LUQ. Structures that you would find in here would include the stomach and the spleen, and a little bit of small intestine and large intestine. If you go off to the upper right side, we have the right upper quadrant, and this is where we are going to have the liver and the gallbladder. The right lower quadrant and the left lower quadrant are both going to contain specific parts of the intestines. For example, appendix is located in the right lower quadrant. We are now going to start talking about the 11 body systems. All of these 11 systems work together to maintain homeostasis. Although we will have a specific lecture on each of these 11 systems, but you do need to have a basic understanding of each of these before we move further into this course. The integumentary system is going to contain the largest organ of the body, which is the skin. This system is going to have a number of different functions. For example, it helps to protect the body, and it has a purpose in thermoregulation, meaning it's going to help us maintain our body temperature. You will also learn that integumentary system helps with vitamin D production, gives us sensations such as touch, warmth, cold, and pain. The integumentary system is composed of skin, hair, nails, sweat glands, and oil glands. The skeletal system is composed of the bones and joints. This system provides us with a framework and protect the vital organs in the body. Skeletal system also helps with movement by acting as a lever by providing attachment site for muscles. There are a few less known features of the skeleton as well, including hematopoiesis, which just means it produces blood cells, and storage of some minerals such as calcium and magnesium. The muscular system is made of 3 types of muscles, which include skeletal muscle. They are found attached to skeleton. Smooth muscles, which are found in the wall of hollow organs such as esophagus. and cardiac muscle, which makes up the wall of the heart. Skeletal muscle helps us with movement and maintaining a proper posture and also thermoregulation. The nervous system is one of the most complex systems in our body. This system consists of the brain, spinal cord, nerves, and sensory organs. The function of nervous system is to receive sensory information, analyze the sensory information, and then show a response based on the sensory information. Then we moved to the endocrine system, where you will learn about different glands and hormones. The endocrine system is the other regulatory system similar to the nervous system. However, it's more of a long-term regulatory system. The function of cardiovascular system is to transport nutrients, hormones, and waste materials from one part of the body to another part of the body. This system consists of the heart, blood vessels, and blood. The function of lymphatic system is to fight off infection and provide immunity. Lymphatic system also drains excess tissue fluid and returns it back to the cardiovascular system. This system is comprised of lymphatic vessels, lymph nodes, spleen, thymus, and bone marrow. The function of digestive system is to break down food into smaller particles and absorb nutrients. Digestive system consists of mouth, tongue, teeth, pharynx, esophagus, stomach, intestine, and accessory organs such as liver, gallbladder, and pancreas. Then we have respiratory system, which helps to get oxygen from the air and get rid of carbon dioxide. Respiratory system consists of the lungs and air passageways such as nasal cavity, pharynx, larynx, trachea, and bronchial tree. Urinary system has to do with filtration of blood. It removes wastes from the blood and helps to maintain a normal level of body fluid and electrolytes. Urinary system consists of kidneys, ureters, bladder, and urethra. Urinary system also helps to regulate or maintain a normal level of body pH. Finally, we will study reproductive system. The purpose or the function of reproductive system is to produce sperm and oocyte. This system also helps to produce sex hormones such as testosterone in male and estrogen and progesterone in female. These hormones are responsible for sexual characteristics. There are quite similarities between male reproductive system and female reproductive system. However, we will also focus on some distinguishing features. Let's now move on to learn some essential anatomical terms. We will cover some basic terms in this lecture, and we will keep adding more terms as we move forward in this course. Before I describe the anatomical terms, let me establish a standard body position in which we will apply all the terms. This body position is called the anatomical position. Anatomical position refers to a position in which the person or the patient is standing upright with their feet on the floor, the arms are at their sides, and the palms and face are directed forward. Notice that the thumbs are pointed to the outside. Now, you don't have to ask your patient to stand in the anatomical position, but we will always imagine this body position when utilizing the anatomical terms. I also want to add, when we are determining sides, we will always go off of the patient's left and patient's right side. We never go off of our own sides. Now that we have understood the anatomical position, we can discuss the different directional terms with respect to the standard body position. On this slide, I have chosen some of the more common directional terms. This is not a complete list, but these are the ones that you're going to see the most in your studies of anatomy and physiology. The first group are anterior versus posterior. Anterior means towards the front of the body, whereas posterior means towards the back of the body. You are going to have different structures that are named with those directional terms. For example, the windpipe or trachea is anterior to the esophagus. The next set is proximal and distal. These terms are only used in peripheral body parts, which include arms and legs. Proximal and distal indicate how close a structure is to the attachment sites of the arms or legs. For example, shoulder is proximal compared to the elbow, and ankle is distal compared to the knee. Then we have superior and inferior. Superior means towards the top or towards the head, and inferior means away from the head. These two terms are only used in axial body parts. Some examples include the mouth is superior to the chin and the stomach is inferior to the diaphragm. Next we have lateral and medial. Medial refers to structures closer to midline, and lateral indicates a structure away from the midline. For example, the lungs are lateral to the heart. Finally, we have got superficial and deep. Superficial refers to structures towards the surface of the skin, and deep means deeper into the body, away from the skin. For example, in the arm, muscles are superficial compared to the bones. Next, let's see how we can actually divide the body into what we call planes or sections. We use these sections to view the internal organs using advanced technologies such as CAT scan or MRI. There are three sections. Sagittal section is a section which divide the body into right and left portion. Frontal section, also called coronal section, is a section of the body that splits it into front and back portion and is perpendicular to a sagittal plane. And finally, transverse section is a division of the body that splits it into a top and bottom portion.